If you've ever seen The Raid, you know that it's got some of the best action sequences found in any movie out there. It makes many Hollywood movies look ridiculously tame by comparison.
I just want to talk.
Maybe that's not a fair comparison, but you see what I mean. A typical Raid fight sequence is, of course, usually quite brutal, nauseating even to those who have trouble watching the
ultra-violent,
as Alex from Clockwork Orange once said. But there is always a method to the madness.
Blue 22, hot!
And today, we're gonna tackle the notorious drug room fight scene, which is a 3-minute burst of pure adrenaline. What an entrance. Now, as we'll see, this scene features many possible injury mechanisms, coming at us all at lightning speed. There are too many critical blows to analyze them all individually. That's 2 men dispatched in under 8 seconds. Instead, why don't we take a more methodical approach? There are a few different flavors of attack that are used by everyone involved in the fight, to greater and lesser degrees of success. We're gonna break down the fight by attack patterns and the associated injury mechanisms, and I'll look at the most critical injury in each category in greater detail. Are you ready, interns? For the first course, we've got throws. You know, people getting lifted, choke slammed, heaved, and tossed. We'll take a quick look at a couple of examples in each category, then take the most injurious instance and break it down in detail. We've already seen this. And of the 13 attacks that could be considered a throw, this attackee is lucky enough to land in a pile of barrels. Unless the chemical dust that puffs up upon impact is toxic, this guy will be ready to return to combat in no time. Lucky him. This throw is much more taxing. Running full speed across the table, then jumping into the arms of a trained operative is a great way to suffer blunt force trauma to the head as a result of being unceremoniously thrown to the floor. Judging by where he's holding his back, he may have sustained a mid-thoracic or lumbar spinous process fracture as a consequence of the impact with a cabinet, or a ruptured anterior longitudinal ligament as a result of the forced spinal extension upon contact. But there's no time to dwell on that because, like I said, this scene is action-packed. And although this move is creative, an upward slam from underneath a wooden table is not likely to do much damage. The victim's chest is the first area to make contact, and his neck is rotated to the side, keeping the face out of harm's way. It will be difficult to generate sufficient momentum to cause whiplash in the neck or even knock the wind out of someone over such a short distance.
Ow! Okay. Okay.
And the height of the subsequent drop is nothing to write home about. If only our next victim were so lucky. This move definitely wins top points for style and creativity, and turns out to be one of the most brutal. Not just because of the throw per se, but because the throw is followed quickly by a pin to the ground, a boot stomp to the face, and then a boot right to the neck, in the end, killing him. Let's break it down. The attacker feebly tries to deliver a high kick to the SWAT guy, misses, and he is grabbed by the shin and planted onto the floor, pinning him there. The attacker isn't yet injured, but he is definitely disoriented in a compromising position. But life comes at you fast in The Raid, and our SWAT guy quickly stomps on the side of the man's face with his boot, and damage is thus incurred. Like, yeah. What sort of damage? Definitely damage to the jaw would be sustained here, as about 9,000 newtons of force would be coming down hard on this guy's face. The blow strikes him in the side, or in such a way that his face is pushed sideways, with the jaw taking the brunt of the blow, likely breaking his jaw and smashing quite a few teeth. We see blood hit the ground where the boot comes down. Complications of a broken jaw, according to Mount Sinai Health Library, include, well, a lot of things. Airway blockage, aspiration of blood into the lungs, TMJ dysfunction, or a wonky jaw that won't open or close properly, misalignment of the jaw, and an inability to speak properly, among other things. There would also likely be injuries to his skull, as his head is sandwiched between a crushing boot and the floor, with definite potential for a concussion or an intracranial bleed to occur as well. But the fun doesn't stop there. What concerns me more is the sharp rotational force that is applied to the neck. Before the stomp, the man's face is pointing upwards towards the ceiling. In a split second, his chin rotates slightly beyond his right shoulder.
The head dropped. That's good.
Spinal cord injury, ligament and muscle strain, and cervical artery dissection come to mind. And that's not the end of it. Next, our SWAT guy does a quick twist of his foot, forcing the neck into a combination of rotation and extension. And we hear a crunch as the man's neck snaps, probably indicating a broken neck. You know, a cervical extension type teardrop fracture where a portion of the anterior corner of the vertebrae is pulled off the main body of the vertebrae. Not necessarily deadly, but potentially a problem. Now, normally we think a broken neck means death. As it turns out, you can sustain a broken neck and live to tell the tale.
I'm just messing with y'all, I'm fine.
Spine Universe says, absolutely, not only can you survive, but with the right treatment, you can thrive afterward with few ill effects.
I call this one fish out of water.
Not sure that that's what happened to our guy in the movie, but still, good to know. Breaking your neck is a layman's term for a whole series of injuries, says Payam Farjudi, MD, an orthopedic spine surgeon at the Spine Health Center in Orange Coast, California. You can break or chip a bone, you can have a break that causes a bone to lose alignment, or you can have a break that causes the bone to go through the skin. All are ways a person can break their neck. Doesn't mean you're gonna die. In the case of our ne'er-do-well, it doesn't appear any bone has perforated the man's skin, but it would require some further analysis to determine the extent of the damage, which could range from very bad to RIP. I'm guessing RIP. It would seem that approaching operatives from the raid with a wild high kick just isn't a good idea. Here we see a man swung by his leg, taking the pillar head on, cracking the concrete. This type of force can easily cause a concussion or a traumatic brain injury. It looks as though his forehead or frontal bone sustains the brunt of the impact, and although his skin doesn't appear to be broken, his trigeminal nerve, which is responsible for sending pain, touch, and temperature sensation from your face to your brain, has definitely been stimulated. Alternatively, even when the raid members are the ones kicking, things seem to end in a similar fashion. A push kick to the attacker's knee and a spin kick to his face, sending him straight into a concrete pillar. Ouch. The push kick doesn't hyperextend the knee, though it easily could have. Anyone remember Modestus Bukkakis?
Oh! That's it! Wow!
This type of attack has the capacity to sequentially tension the cruciate ligaments until failure, disrupt the posterior capsule, and possibly injure the collateral ligaments and the menisci as well. With these ligamentous injuries, the knee becomes unstable in the sagittal plane, incapacitating the opponent in the process. But a raid operative leaves no job unfinished. The roundhouse kick could easily strain the muscles and ligaments in the neck and cause a fracture in the bones of the face, seeing as it is delivered with a heavy tactical boot and all. But the victim won't be worrying about that, since the subsequent collision with the concrete wall knocks him unconscious. This guy isn't much better off. The raid operative administers a kick to the side of the victim's knee, sweeping the leg out from underneath him while his other is still airborne. The knee joint rotates inward slightly, stressing the medial collateral ligament, the lateral meniscus, and the lateral femoral condyle as he collapses to the ground just in time to receive a spinning roundhouse kick, boom, to the face. Another attacker rendered unconscious. Concussion yet again. Though theatrical, the blood on his face may be the result of superficial facial damage. You know, like a split lip or damage to the nose, which is packed with so many blood vessels that even minor injuries to the face can cause the nose to bleed.
Oh, this is a comical flop. I mean, born doctor. Come on.
That being said, a kick delivered with such force to the front of the face could easily fracture the nose or damage the zygomaxillary complex. There are other ways to damage the bones in the face. Here, a member of the Special Operation Unit is keen to include the bones of the face and skull in the zygomaxillary party.
And I'm just ferocious. I want your heart. I want to eat his children. Praise be to Allah.
The right orbital may also sustain damage, as well as the bones on the side of the skull, such as the sphenoid or the temporal bone. Repeated impact would magnify the likelihood of concussion, or TBI, since each slam is 2 impacts on the brain, as it jostles around the inner walls of the skull for the coup and contra-coup injuries. After witnessing this man's brutality, what happens next shouldn't surprise you at all. Give him the chair. And so we transition into the world of weapons. This chair looks to be made of metal and swung like a baseball bat at the outside edge of the knee. It could easily cause a multi-ligament injury involving rupture of the medial collateral ligament, the cruciate ligaments, and the menisci of the knee in a manner similar to that described above. The overhead slam connects with considerable force at 2 main points: the enemy's left hip and shoulder blade towards the upper thoracic spine. The blow doesn't connect directly with the spine or any vital organs, and the enemy is propped on his elbow at the moment of impact, allowing his body a little give when it is struck. I doubt this blow would render the foe unconscious, and it doesn't look like the chair is fashioned of heavy enough metal to outright crush his bones. In real life, possibly some rib fractures or maybe some contusions. Psst, I suggest you stay down. Some of your colleagues are tangled up in the knife fight. That looks a lot worse. In this scene, there are 22 knifings in total, between 4 knifers. As you'll see, everyone has a giant knife. Maybe they have a tradition at the drug office. Obviously, Rama has come to crash the party. First, Rama stabs this man adjacent to the base of the neck, between the trapezius muscle and the clavicle bone, with his own knife, using the guy's own hand.
And isn't it ironic? Don't you think?
Ironic indeed. I wonder if he realizes it as he slips into the next world. Actually, this guy might not be dead. Yet. But there are several important structures right around the entrance point of the blade. The subclavian artery lies just below the clavicles, providing blood supply to the bilateral upper extremities with contributions to the head and neck. A deft stab could easily puncture or sever this artery, causing the victim to bleed out if left untreated. It's also possible that he's also off screen having an episode of trauma-related dysesthesias of the upper extremity as a result of injury to various critical nerves in his neck and upper back. The Cleveland Clinic reports that cutting the vagus nerve in the neck reduces gastric acid secretion, but also reduces functions of other organs that respond to the nerve. It can reduce bile and enzyme secretions for your liver, gallbladder, and pancreas. It can also reduce peristalsis, the muscle movements that carry food through your digestive system. I think these next 5 seconds are worse. This string of attacks would give both these guys' moms heart palpitations if they were watching. As fate would have it, our hero manages to avoid any serious injury and dispatches those 2 evildoers in a hurry. The man on the left receives 4 stab wounds in under 5 seconds, all of which seem to land around his neck area. According to a National Library of Medicine 2022 paper, the management of neck trauma can be challenging and sometimes overwhelming, as this anatomical region contains many vital structures. These structures may pose a diagnostic and therapeutic dilemma in the emergency department. Yeah, no doubt. For descriptive and clinical management purposes, the neck is divided into 3 zones. Zones 1, 2, and 3. In penetrating trauma, zone designations have anatomic, diagnostic, and management implications when dealing with trauma situations. Without getting too deep into the weeds of neck zones, suffice it to say, this guy takes injury to all of the zones, totaling 4 wounds to the neck, and nasty ones at that. This means he's in grave danger of dying quickly from blood loss, inhibited breathing, and severed nerves. His chance of survival is low, real low. The other guy's wounds are seemingly not as grievous, as he takes a slash to the belly and one to the leg. The slash to the belly likely only penetrated the superficial layer of skin and subcutaneous fat, treatable with stitches and a bandage. The blow to the knee is slightly more concerning, causing his leg to buckle. Harvard's Orthopedic Journal says, stab wounds to the knee are associated with a wide spectrum of injuries and necessitate careful assessment for proper diagnosis. Penetrating injuries to the anterior knee can result in partial or complete quadriceps or patellar tendon laceration, and may require advanced imaging to confirm diagnosis. Management of acute tendon injuries can be challenging, and although primary repair is often the treatment of choice, late reconstruction may sometimes be required. Deeper wounds penetrating the joint capsule place intra-articular structures at risk. They also carry the risk of infection. Knives and knees may not be the best of friends, but this blow is survivable. And then, before you can say Raid 2 redemption, he takes a knife directly in the upper middle of the back. That the knife does not penetrate far into the body suggests that it has struck bone relatively close to the surface, either a low cervical vertebrae or upper thoracic vertebrae. A sharp downward stab could easily penetrate the bone and cause fracture to occur in a number of structures on the posterior vertebrae, such as the spinous and transverse processes, potentially the facets, lamina, or even the pedicles. If the knife penetrates deep enough, there is a chance that it could enter the foramen and puncture the spinal cord, which is associated with a whole host of very bad consequences, ranging from loss of sensation to loss of function below the point of the injury. Even a fracture to any of the aforementioned structures could irritate the delicate spinal cord. And we're not even through with the weapon attacks yet. I'm gonna have to deem this a homicide and keep moving.
Open and shut case, Johnson.
The next attacker seems to have the upper hand, employing a kick to the knee to bring one of our heroes to the ground. But then, a heroic turn of fate. Our hero once again becomes the aggressor, slicing his enemy's wrist and belly, and then slicing his throat open with a spin to finish him off with some panache. The flexor tendons on the inside of the wrist may well have suffered damage as the enemy drops his weapon to the ground. The penetrating abdominal trauma could easily have punctured his small or large intestines, causing the partially digested food, or worse, fecal matter, to leak out into the peritoneum. Can anyone say peritonitis?
Peritonitis.
Typically, these injuries require surgery. But again, this enemy won't need to worry about that given the vicious slash to his neck. Security Magazine states, a horizontal cut across the neck and throat will not only sever your jugular vein and cause death, but will also cut the trachea and ligaments that control movement of the head. The future isn't looking very bright for that dude. In his final moments, perhaps he's wishing he'd encountered a raid operative armed with only his fists. Well, I counted about 85 strikes involving the bare hands, punches, elbows, chokes, pushes, palm thrusts, and karate chops. And let's just say, the Special Forces members in the raid are experts at neutralizing enemy forces, weapons or no. Now, with enough force, a karate chop could crush your trachea and make breathing a problem. This could even be fatal, as a blocked airway could mean death. As you'd expect, the striking continues. But if I had to give an award for most brutal strike, it would have to be this. A punch to the side of the throat, followed by a choke slam. Injury followed by insult, and then more injury. Bad luck for a man who came in fighting with 2 kicks and a strike, which were blocked easily. A blow to the midsection stuns him long enough for our SWAT team friend to grab the guy by the left side of the neck, holding him in place so he can deliver a punch to the right side of the man's neck. When dealing with blunt force trauma to the neck, the Royal Children's Hospital in Melbourne reminds us to consider the 4 types of vital structure in the neck: airway, vascular structures, nerves, and the gastrointestinal tract. In this case, if the fight stopped there, we would need to be very gentle in examining exactly the extent of the injuries to his neck. The vertebral compartment of the neck contains the cervical vertebrae with cartilaginous discs between each vertebral body, the alignment of which defines the shape of the human neck. As we've already discussed, These stacked vertebrae form a canal that houses the spinal cord. This punch would undoubtedly put pressure on the middle cervical vertebrae and could cause dislocation. The hand on the neck suggests that that wasn't our hero's intention. Both the carotid artery or vagus nerve run up the side of the neck through the vascular compartment of the neck. The carotid strike, also known as the Okinawa slap, will cause a sudden loss of oxygen to the brain, followed by fainting and collapse. Similarly, when the vagus nerve is struck, it can cause severe dizziness and can possibly knock someone out. On top of that, the visceral compartment of the neck accommodates the trachea, larynx, pharynx, thyroid, and parathyroid glands. Obviously, a lot can go wrong. And the unceremonious chokeslam that breaks the table WWE style, well, that's just the icing on the cake. I could go on, but I won't. The problem here is, with these goons, no one's going to come to their aid, and many of them will die from their injuries or be crippled. We will always remember them the way they were, and most of them died doing what they love, sorting through massive amounts of cocaine to increase the wealth of some type of mafia drug lord. Well, that about wraps it up for now. Hope you enjoyed my breakdown of the raid drug scene. And as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.